Hello there, and thank you for joining us this evening for Dr. Richnack's presentation on alternatives to surgery and reducing pain. My name is Dana Nadeau, and I work closely with Dr. Richnack on the Regenexx aspect of his business. And I wanted to just go over a few housekeeping items before we get going with the presentation. The presentation itself will be about 30-35 minutes. And then after the presentation, there will be opportunity for questions and answers. And the way we'll go about that is, if you look down at the bottom of your screen, there is a raise hand function. And if you have a question, you will simply click on that. It will notify Dr. Richnack that you have a question, and he will unmute you, call on you, and you can ask your question. If anybody has any questions during the presentation, there is a Q&A feature for written questions. And you can also do that, and I will do my best to answer your questions. And if I don't have an answer, we'll refer you to Dr. Richnack at the end of the presentation. So I think that covers it. And I hope you find the presentation very informative and valuable. And I will now introduce you to Dr. Joel Richnack. Thank you.
Okay, hi everybody. I am Dr. Joel Richnack, and I want to welcome you tonight to our webinar, where I hope to impart upon you all some more information on this very exciting field of regenerative medicine, and to show you how not only has it become a very important tool in my toolbox in terms of addressing these stubborn, if you will, orthopedic issues, but I also want to impart upon you just how powerful an alternative it appears to be for people who are considering the surgical option. So a little bit about myself. I've been practicing. I have my own private practice with my partner, Dr. Mike Jensen, here in Grass Valley, and I've been practicing for, well, over 18 years now here in Grass Valley. And I am dual boarded in both physiatry, which is neuromusculoskeletal specialty, as well as sports medicine. I've been a Regenexx provider for over 5 years now. But to be fair, I've been doing some form of regenerative medicine since residency, so for close to 20 years now. Another important aspect about myself, which I've found has really shaped not only my life, but also my medical practice, is I've had a very active lifestyle throughout my life. And this has shaped not only my life, but again, my practice of medicine. And first and foremost, these various activity regimes that I'm involved with were initially just to help me explore the beautiful surroundings of the Sierra Nevada mountains, which I was fortunate enough to grow up in. And over the course of time, it was a tool, a very exciting tool to allow me to have these adventures. But eventually that morphed and evolved into developing a deep curiosity on how this body works, how it functions, how it moves. And so that fueled my aspirations for becoming a physician. And then, of course, over the years, by being active, I've had my own fair share of injuries. And each and every injury I've had, I've learned a lot from. And so it's really helped me learn more about how this body heals, how myself heals, but also equally as important, how to rehab from these injuries. Because oftentimes, as many of you know, these injuries can keep us from doing these activities that we love doing. And so again, it's taught me a lot about not only healing, but how to rehab from these injuries so that we can get back to doing these activities that we love. And so from that standpoint, it's also shaped our philosophy here at Mountain View Rehabilitation, which is we really do have a passion for getting people back to doing what they love, what they want to be doing. So again, it's shaped my treatment philosophy as well. Why are you all here? Well, certainly many of you have your own orthopedic issues that are contributing to pain issues and downtime. Maybe you've exhausted various conservative treatments and looking for something alternative to surgery. Or you've seen a surgeon and you've been determined not to be a surgical candidate. Looking for options, don't want to rely on meds, and want to get back to doing what you want to be doing. So tonight we'll cover a few subjects. First, we'll kind of review the traditional current options in orthopedic care. And then I'll introduce you to these terms, regenerative medicine and interventional orthopedics, and explain a little bit more thoroughly what they are. And then we'll spend a little bit of time talking about what is Regenix and why Regenix is so different than any other provider out there offering this technology. And then we'll clarify some misrepresentations in this world of stem cell. And then finally, as Dan alluded to, we'll finish up with a question and answering session, which oftentimes tends to be the most robust part of the webinar, simply because many of your questions oftentimes apply to everybody. So again, we'll spend some time with questioning and answering at the end. So current options in orthopedic care, basically it breaks down into 3 different categories. Many of us start this journey looking at various medications, and if that doesn't work, we explore the whole conservative treatment foundation, if you will, or non-surgical treatment. And then traditionally, if all else fails, then oftentimes we are sent to a surgeon to see what they can do for us. So pharma, again, many of us start in this area taking simple over-the-counter medications. We're just trying to address the pain that we're getting in hopes that a simple medication will allow us to get back to being active. If this doesn't work, then oftentimes we'll go see our primary care physician and get a prescription strength medication, or opiates or steroids, whatever it may be. But ultimately, most of us come down to learn that this is simply a temporary Band-Aid at best. And of course, all medications have potential side effects, and some of them can be serious. So that leads us to explore the non-surgical or conservative treatment options. And this can vary from physical therapy to chiropractic treatment, acupuncture, massage, or even just simple bracing. And to be fair, I am a rehab physician at heart, so I do strongly believe in particularly the physical therapy model. And everybody who comes to my clinic, I always review the goals of treatment, which is first and foremost to address the pain. And then once the pain's addressed, it's critical to train that patient in exercises, corrective exercises, that oftentimes can correct these mechanical deficits that lead to the injury in the first place. So again, I find that 80+% of the time, conservative care can get these issues addressed. If we're having challenges getting the pain addressed, and sometimes we resort to injections, most commonly steroid injections, but in the case of knee issues, particularly arthritis, sometimes we'll consider the hyaluronic acid injection, which many of you are probably familiar with. But again, oftentimes these are not effective for long-term management. And then of course, steroid has its own issues. It's toxic to our cells in its own right. So traditionally, again, if all the above fails, many of us find that our primary care physicians are sending us to the surgeon to see if their treatment, whether it be replacing a part removing parts or repairing tissue can address the issue. Now, in the last 5 to 10 years, there's been more research regarding surgical options than there has been in the previous 100 years. And much of what this research is telling us is that there are some surgeries that are just ineffective. Obviously, there's risks to surgeries. And even if it was advisable or medically advisable anyways, it doesn't always work. And then, of course, once done, you can't undo it. Now, diving into the research a little bit further, this research literally shows that 50% of the surgeries are ineffective in clinical trials. So, again, clearly there's holes in the surgical model. And of course, that beckons the question, what other options are there? So with that, I want to introduce to you this world of regenerative medicine. And again, at least in my clinic, I am finding this to be a very powerful alternative to surgery and even other conservative treatments. So what is regenerative medicine? Well, in a nutshell, it's using our own cells, namely platelets and stem cells, which can, in cases, repair injured tissues, such as tendons, ligaments, meniscal tears, labral tears, even nerves and discs. Or in the case of more severe degenerative changes like arthritis, can help alleviate the symptoms related to arthritis and improve the health and functioning of that arthritic joint. What can be treated? Well, in my clinic, we treat all orthopedic issues, ranging from knees, shoulders, hips, spine, elbows, hands and thumbs, as well as feet and ankles. And as I'll show you here in a minute, all joints are essentially similar in the sense that they have cartilage, they have tendons, they have ligaments, or sometimes they have this other spacer, soft tissue. And so there's various tissues in each and every joint that can become injured, and consequently, specific treatment can be applied to these very specific injuries. What is interventional orthopedics? Well, interventional orthopedics is essentially using technology, namely ultrasound imaging, as well as X-ray visual tools, which, when used effectively, can help guide these treatments so that the treatments are very specifically placed to the torn tissue. So in a nutshell, it really ensures the success of regenerative medicine. And without it, the success of regenerative medicine goes down significantly. The correlate to interventional orthopedics is this world of interventional cardiology. Now, many of you may recall at one time that most people who had some sort of heart procedure went to go see a cardiothoracic surgeon. And the surgeon, in order to access the heart, would usually have to access it through opening the chest. Well, a very smart cardiologist discovered a means of essentially sending a camera and small, tiny tools, if you will, through a catheter in the vessel in an individual's leg, and using X-rays to help guide the catheter to the heart can apply the specific treatment. And again, using a very minimally invasive procedure. And the effectiveness of this was such that nowadays, 70 to 80% of what used to be done by a cardiothoracic surgeon is done by an interventional cardiologist. And in large part, again, because it is minimally invasive, there's less downtime, there's less risk, with equal efficacy. So similar minds in interventional orthopedics, or leading minds, I should say, in interventional orthopedics, believe that, again, through this combination of using interventional orthopedics to apply regenerative medicine, that in the next 5 to 10 years, the same be said of orthopedics, that this could replace up to 70 to 80% of orthopedic surgery procedures. So again, a very powerful combination. And again, it's minimally invasive, using needles and guiding that needle to the specific tissue. So diving into that a little bit further, so in the realm of orthopedics, there's various treatment options available, ranging from simple injections all the way to surgery. Now, just about everybody in orthopedic medicine, as well as surgery, provides simple injections. But what is a simple injection? A simple injection is essentially taking a shotgun approach to addressing these injuries. It's injecting a steroid in the vicinity or the area of where one is experiencing pain. So a lot of times these injections are done without making a very specific diagnosis. And again, they're designed to kind of get into the area and hope that some of that medication can hit the injured spot. Now, with the advent of technology, there's more and more people that are bringing in ultrasound imaging to their offices, but they're still doing very general injections. They're, again, not making very specific diagnosis and not necessarily treating a specific issue. So with interventional orthopedics, the first thing that interventional orthopedist does is recognize that, say, in the case of a hip, there's various tissues that could become injured. Again, labrums, tendons, ligaments, the joint itself, sometimes even the bone or the muscle. So, the first goal, first and foremost, again, is identifying which specific tissue is the culprit. And then, of course, using ultrasound, or in some cases, x-rays, to help guide the needle specifically to that tissue. Again, the precise placement is the critical component of making regenerative medicine successful. So that's the hip joint. Likewise, the knee joint, there's various tissues that could become injured. And so that specific injured tissue has to be identified and then treated specifically. And then finally, the same holds true with a shoulder joint, or any joint for that matter. What do we inject? Well, here at my clinic, we inject either concentrated platelets, another platelet product called platelet lysate, or stem cells. What are platelets? Well, platelets are cells that come from your blood. So a platelet procedure starts with a simple blood draw. And once it's processed here in the lab, at the end of that processing, we have a very concentrated platelet solution. And platelets are loaded with various proteins that, namely cytokines and growth factors that, first and foremost, cytokines are very powerful proteins that can clean up inflammation. And chronic inflammation is typically the cause of pain issues. And so the cytokines can calm that inflammation down to address the symptoms. And then the growth factors take over to get the whole healing process up and going again. So with platelets, we are finding this extremely effective at treating torn tissue, such as tendons, like a rotator cuff injury, or even certain ligaments, as well as muscles, and even in cases up to mild to moderate arthritis. Platelet lysate is taking that platelet, and this is in a laboratory setting, and essentially lysing or rupturing, I should say, the membrane that holds all these cytokines and growth factors. And we're finding that by doing this, it's a lot more powerful in terms of mopping up inflammation, and consequently can minimize what we call acute inflammation. So we're finding this very effective at treating nerve injuries. Straight platelets, we found, actually inflame the nerve too much. So we're finding it's much more effective at not only healing these injuries, but again, addressing inflammation that's caused by the injuries. And specifically, we'll use this in issues such as carpal tunnel or compressed nerves in the spine. Stem cells, in the hierarchy of regenerative medicine, stem cells is the most powerful healing stem cell that we have. And the analogy of stem cells is they're kind of like the general contractor or the conductor of an orchestra, if you will, in that they, first of all, send signals to all these this vast componentry of cells that contribute to the healing process. gets them to the site of the injury and gets them working in a synergistic fashion to contribute to repairing that injury. We get stem cells specifically from bone marrow aspiration. Again, stem cells can heal more significant tears, especially issues like ACL tears in the knee, or if there is a full tear of, let's say, rotator cuff tendon, we tend to go to a heavy hitter like a stem cell because it's more powerful at addressing more extreme tears. But we're also using it in the case of more moderate to severe arthritis. So in the clinic, the procedure breakdown is essentially 80% of what we do are platelet procedures. So 20% of what we do are stem cell procedures. And this is significant simply because there's a pretty big cost difference between the two. So it's important to understand that many of these injuries can be addressed with just platelets. Platelets are very powerful in their own right. So what is Regenix? Well, Regenix really is one of the founders of Regenix, I should say, are truly one of the pioneers in both the world of regenerative medicine as well as interventional orthopedics. They've been doing this since 2005. To be fair, they stood on the backbone of our veterinary colleagues who have been applying this treatment to the equine, the horse world since the late 80s, early 90s. And so, I would say the biggest stockholder of research we have our equine colleagues to thank because they've been studying this longest. But the Regenix folks were really some of the first people to apply this to us, to humans. Again, they've been around for quite a while. And what's different about Regenix? I mean, as many as you probably started your own research out there. There's a lot of clinics offering various regenerative medicine procedures. Namely, some call it platelets. There's also the amniotic world. Others do offer stem cell as well. What I want to try and just impart upon you next, it's just that there is a lot of difference between what we do at Regenix and these other clinics. Namely, I've already touched upon the experience component, but Regenix, and I'll dive into these a little more thoroughly in a moment here, but they're one of the few clinics that devotes a considerable amount of their energies to research, both clinical and lab, as well as to the lab platform. As I mentioned earlier, anybody who's doing Regenix procedures are using image guidance. Data registry is how we accumulate our data. So anybody who gets a Regenix procedure is invited to be a part of this data registry. And I'll get a little bit more into that in a moment. All Regenix are specialists. All we do is orthopedic medicine. Many clinics, this technology is being offered by chiropractors, primary care physicians, people who are not necessarily involved in orthopedics at all. So we'll discuss how our cell sourcing is different, how our harvesting is different, as well as our dosing. So starting with the experience, again, we've been doing this since 2005. And so obviously, a lot of procedures have been done since that time. And that lends itself to learning, to experience, to expertise, and of course, research. And ultimately what that all means is outcomes. With all this knowledge, the likelihood of good outcomes is going to be much greater. Our lab platform is probably one of the biggest areas that we're different than most clinics. I mean, many people who offer platelets or even stem cells, they have essentially what's called a desk-based centrifuge. And what that means is, once the blood's drawn or the marrow is accumulated, it's put in the centrifuge, a button's hit, and out, a few minutes later at the other end of it, comes the product. And this product is the same product for each and everybody who goes through this process. With our lab platform, yes, we do use centrifugation, but we also have a sophisticated laboratory hood with sophisticated tools that allows us to, after the spinning process, we're able to take certain layers out of that and process it further. So through that process, we're able to offer, much more concentrated and customized version of this. The idea is that each and every one of us is different, different ages, different injuries, different degrees of injury. So what we're actually doing in the lab really has to curtail towards that specificity. So we're able to do that with our lab platform. Regenix cell source supplies predominantly to where we get bone marrow. We'll talk about this a little bit later. One of the misrepresentations of stem cell out there is this amniotic world, which is just essentially getting fluid from a mother who's had a C-section. And again, I'll dive into this a little bit further, but I'll explain later why this isn't really, it's not a stem cell at all. So we get our stem cells from bone marrow aspiration. This is the only stem cell that is compliant with the FDA, and therefore is the only legal approach to getting stem cells. And consequently, it's also the most research. And we've found through the research is also one of the more powerful forms. So again, this is the best means of getting stem cell, which again, translates into better outcomes. Another aspect of cells is concentration. And so we have devised ways of harvesting or our aspiration techniques we've refined over the years to help us optimize the number of cells that we can aspirate from. And so through lots of trial and error and research, we have found ways to increase that yield. And again, it's one of those things that the more cells we have in regards to stem cell, the more likely one's going to have a good outcome. I kind of went into this a moment ago. Dosing is important. Again, with a regular bedside centrifuge, the dosing is the same for everybody. But as we all know, we're all different. We have different ages, different injuries, different degrees of injuries. And so what we're able to do is customize that dose to the specific injury itself. And again, once again, that leads to greater outcomes. I won't go into any further into the importance of image guidance. I've gone through that thoroughly already. But again, ultimately, the key to success with regenerative medicine is being able to place the cells very specifically to the injured site. So the data registry is really the core of our research. So again, anybody who has a procedure with us, we invite to become a part of this data registry. And what that means is, over the course of time, one is sent questionnaires just to assess how they're doing, what their response is, what their functioning is, what their improvement has been. And so we've accumulated results for, I think this slide's a couple of years old, but at this point, probably 30 to 40,000 patients. And that information does feed into our research. So again, anybody who has a procedure with us does become a part of this research family. And with this information, we've been able to publish, the biggest volume of research in the world. So Regenix research accumulates up to 40% of the entire world's literature on this topic. And just to touch upon the importance of research, I mean, one of the things that stood out to me the most when I was vetting various companies before I became a Regenix affiliate, I vetted a variety of companies. And at the end of the day, what made the biggest difference was Regenix devotion to research. It's important to understand that this field is still very young, and therefore we still have a lot to learn. So, what we're offering now is far better than what we were offering 5 to 10 years ago. And again, that's because of research. And research is the critical tool to not only continue to improve this technology, but to make sure it's viable for the long term. So this information has fed our clinical research. And again, we've put out the most number of papers out there. And what that means is the Regenetics community is really trying to push this field, evolve this field, one of the more powerful influences of evolving this field. Likewise, there's constant tweaking of the lab processing. We're finding different ways of, again, optimizing the number of cells that we can accumulate through the lab processing procedure. We're also trying to devise laboratory techniques to help assess joints which can ultimately allow us to provide better prognosis, give people better ideas about what they can expect from the procedure itself, as well as to help plan the procedure. So lab research is something that's ongoing. And again, the Regenetics crew are the people who are pushing and evolving this field more than anybody else. We are specialists. As I say, a lot of people who provide this technology, again, maybe a nurse practitioner, a chiropractor, general practitioner, people who really don't spend a whole lot of time in the orthopedic world. Whereas Regenetics affiliates, this is what we do. This is our passion. This is all we do. That knowledge is really critical to, essentially determining the outcomes. Excuse me 1 second. I just got my battery's running low, so I want to make sure this is plugged in. Okay. So procedure flow. When it comes to a platelet procedure, the platelet procedure starts with an initial 1 hour visit where we get the history, do a thorough clinical examination, review imaging, and sometimes do additional imaging with ultrasound, and then determine if one is a candidate. And if so, proceed forward with scheduling the procedure, which starts with a blood draw. And once the blood's drawn, it takes about an hour or two to process. And then the individual comes in a couple hours later for the re-injection. Oftentimes people go on to getting physical therapy, again, to learn these stabilization exercises, which again tends to be critical in terms of optimizing response to the procedure period. And then we usually see folks 2 months after the procedure. The stem cell procedure starts with the same initial evaluation. And then again, if somebody is deemed to be a candidate, it's essentially a 3-day procedure, usually done on a Monday, Wednesday, Friday schedule. Day 1, we do a pre-injection where we inject an irritant into the tissue. And the idea with that is we're essentially preparing that tissue for the stem cell that we do 2 days later. The Wednesday procedure is the stem cell procedure, and that starts with the aspiration, bone marrow, and then the processing of the bone marrow takes a bit longer, takes 3 to 4 hours to process. And so we will usually do that procedure in the morning and then bring in the early afternoon for the re-injection. And then day 3 is we inject platelets into the tissue. We get platelets in this case, again, through a blood draw. And the idea of adding platelets to a stem cell procedure is that the platelets have all the growth factors and such that the stem cell needs to optimize its healing response. And then again, oftentimes that's followed by rehab and a follow-up 2 months later. So just to dive into some of the stem cell hype and misrepresentation, the biggest culprit, I alluded to this earlier, is this world of amniotic injections. And what makes this so concerning is that they're marketing these products as stem cell products. We have in our own clinic assessed these products, multiple products, as has dozens of reputable universities. And we have found that these are essentially a dead tissue product, meaning that any viable stem cell has been killed off in the processing of the product. It's not to say that there are not other regenerative products in this particular product, but again, this is considered a dead tissue product and consequently has been regulated extensively by the FDA for several years, and over the last year or two has really been enforcing this regulation and shutting down a lot of these clinics who are calling it stem cells still. So how do they work? Again, they do offer growth factors, which are similar proteins that are found in platelets, but the concentration and the volume of these growth factors is a fraction of what is in platelets. But oftentimes is quite a bit more expensive than platelets. So again, oftentimes these procedures are done in chiropractic offices, frequently done without guidance, oftentimes by non-specialists such as a PA or a nurse. Again, dead cell products at costs that are significantly higher than platelet injections. Oftentimes their marketing involves trying to tell you that your stem cells are too old. The fact of the matter is that we've researched this extensively, and we have found that people in their 90s, I've treated people as old as 97, do just as well as younger people. So we're proving this not to be the case in our research. Again, age does not seem to be a determinant of how well people do. What is this? So as you're doing your research out there, I just want to bring up some red flags that are important. So discounting and heavy emphasis on financing could potentially be a red flag. Oftentimes, there are clinics who say they can cure anything from the common hangnail to brain tumors. So if you see clinics that are pretending to be able to offer the magic cure-all, that's probably going to be a huge red flag. Not everyone is a candidate for this procedure. So, if they're not vetting people and seeing, and providing a prognosis, that's probably going to be a red flag. We've been through the amniotic, other words for this are cord blood. There's another product, we can get stem cell from fat, which is actually the research showing is potentially a pretty powerful means of obtaining stem cells. But currently, in order for that to be viable, it has to go through too many, processing, too much manipulation. And because of that, it's actually illegal. Now, as you go and pursue your research further, I'd invite you to take down this website called stemcellreview.com. I found them to be a very unbiased source, and they do a nice, thorough job of rating the various clinics offering this technology. So give them a look as you're doing your research. So in summary, we have found that this technology does offer a very powerful means of addressing these injuries and returning people back to movement without surgery. The combination of regenerative medicine with interventional orthopedics really is the critical means of this being successful. Regenix, truly one of the leading providers and researchers of this field. And beware of the magic stem cell approach. So that's the essence of the webinar. Again, what we'll do next is spend some time, answering some questions. We'll leave this slide up as we go into that answering question phase. Namely because, if you do have questions after the webinar, or if you want to see if you might be a candidate for some of this technology, either give us a call or send us an email at that address. Now, let's see here. I just want to make sure my battery is plugged in. Okay, I think I'm okay here. I want to make sure we don't fall offline here. Let's see, 17%. Okay, we're plugged. Okay, sorry about that. All right, so with no further ado, let me put that back on. Let's get to some questions. That's not coming up. Well, that's fine. Let me jump into some questions here. And again, just if you have some questions, throw your hand up. And we'll just go through the process of unmuting and get to the questions. Now, I guess before we start, I'm not seeing any hands up just yet. Were there any written questions, Dana?
Yes, as a matter of fact, there is one here from Jeffrey Nelson, who is asking, does the removal of marrow have side effects or affect one's ability to generate red blood cells?
Oh, good question.
And actually, why don't you unmute him? He has another question as well. So if you can unmute him, then Jeffrey, you can ask directly to Dr. Richnack.
Let's see here.
Here.
I got it.
There we go. Great. Can you hear me?
Yes. Hi, how are you?
Perfect. Yeah, thanks. Thanks for doing this. This is super informative.
Thank you.
So I had that question just about stem cells, no, pardon me, about the marrow. And then the other was just at one level of like joint degeneration, would you no longer recommend this kind of procedure and really do sort of punt to surgery or something else?
Well, so the later question, good question. I would say kind of end stage arthritic changes involve not only just the wearing down of cartilage and, in the case of knees like meniscus, sometimes we'll even see bone cysts. And what that is essentially bone death. And you understand that bone and cartilage is all one tissue. And the stem cells that keep cartilage healthy come from the bone. If we're seeing, these cysts or the bone actually dying off and even collapsing, then that's probably going to be too far gone to consider a stem cell. I mean, we do find that the stem cells, if injected into the bone, can help with some of these bone lesions. But again, if we're seeing collapsing of that bone, then that might be too far along for it to be successful with stem cells. As far as side effects from the aspiration procedure, the side effects, understand that, although we're taking bone marrow out, we're not using all of it. That's important to understand first and foremost. And whatever we do remove regenerates within, within a month or two anyways. So there's no impairment of, forming new blood cells. So it's not going to lead to anemia or affect your immune system or anything else. So there's no side effects from that standpoint. Good question. And one thing I'll add to that too is understand that most of the research involved with stem cell is in large part based on, assessing safety. And we have, research after research after research really has shown this to be very safe. There's another concern as to whether or not stem cells could make one more susceptible to cancer, or if you have cancer, make that cancer worse. So the research really shows that that's not the case. And in fact, depending on where that cancer is, there are stem cells that can, essentially help fight off that cancer. So again, ultimately, the research really tells us through and through that it's very safe. There's no side effects to speak of. I mean, we are using your own cells, so there's no reaction against it. So you know, again, I mean, again, research is really telling us this is an extremely safe procedure.
And maybe just a quick follow-up, are you aspirating the marrow from more or less the same location as you're then re-injecting, or are you taking it always from the femur, or is it depend?
So we get the bone marrow from the back of the pelvis, a place called the iliac crest, you know, right on kind of your back pocket area. And the reason we take it from there is it's the biggest reservoir, and for whatever reason, it happens to be, you know, most vital stem cells as well. I mean, there's been research on other body parts that just, you know, there's not the volume in other bones, and just not the vitality of the stem cell. So, you know, the pelvis is where we get it, and for multiple reasons.
Thank you.
You're so welcome. Thanks for the questions. Any other written questions, Dana?
No, not at this point.
Okay. All right. Well, so I guess maybe diving into the aspiration part of this a little bit more. You know, I would say that's one of the biggest areas that people become a little bit anxious about, have the most questions, at least when I see them in the clinic. You know, what's the aspiration? I've heard, you know, horror stories about people getting bone marrow aspirations. Let me try and reassure you that, you know, this procedure, again, done to the back of the hip, preceded by a very extensive numbing process. So we numb you up like crazy. And interestingly enough, I mean, actually getting into the cavity, people don't really feel that too much, if at all, for that matter. But when we start aspirating the bone marrow, there's something about that negative pressure that can be a little bit uncomfortable. But, you know, it's a quick 5-second pull. We do aspirate from 3 or 4 different spots on each side. So there's, you know, we do aspirate from a number of spots, but again, it's just that as we're actually pulling the marrow out, there's something about that negative pressure that can be a little uncomfortable. But that's about the extent of it. You know, apart from that, people tolerate that very well. Okay, well, again, if there's any other questions, you know, either write them down or raise your hand. You know, oftentimes this tends to be the most informative part of the discussion. So there are no bad questions. So anybody out there, you know, maybe just, as I mentioned before, we usually utilize the stem cell for more severe injuries. You know, as I mentioned, you know, the severe arthritis, moderate to severe arthritis. We're also finding it extremely effective at treating ACL injuries. You know, there's a lot of research. You know, there's a lot of people who tear their ACL ligaments in their knee. And again, in the past, that was a default surgical procedure, but we're finding that surgery, the research doesn't really support that anymore. It's not the best option. And we are getting some outstanding results with these ACL injuries. And again, with, you know, more severe tendon tears, like rotator cuff tears, that type of thing. But again, just to kind of, you know, reconfirm, you know, most of what we do are platelets. So, you know, most injuries can be more than adequately addressed with the platelet procedure.
Dr. Schnack, we do have another written question, wanting to know what the name of the website mentioned above was. I'm not sure exactly which website. Maybe it was the one where
The
you
research
check for providers.
Yes. Real quick. Yeah, I'm sorry, I don't know why the full screen came off, but doesn't seem to want to start again. But there's the website of, again, it's just www.stemcellreview.com. And again, a very unbiased source. This is a neutral source. It's not affiliated with any specific company, and does a real good job of you know, grading all these various clinics on, where they get cells, whether or not they do research, the various joints that they do. It does a real good job of vetting each and every clinic. And so one of the better tools for the research that I've found out there.
And the question, this is from Lisa Benvenuti, wants to know if stem cell is an option for the spine is one question. And the other question is if after 3 years post-treatment on knees, can it be repeated?
So as far as knees go, yeah, I mean, if necessary, it can be repeated. We're finding that the effects of stem cell can last up to 7 to 8 years. But sometimes it does come back before then, in which case, yeah, we can repeat it after 3 years. As far as spine goes, we're finding that 99% of spine can be treated with platelets. Whether it be a disc issue or a nerve issue or more common mechanical issues such as joint arthritis or ligament laxity. I don't. The only time we'd consider doing stem cell for spine is, say, a disc injury that perhaps didn't respond to the platelets first time around. But again, that really doesn't happen. Platelets appears to be more than powerful enough to address the vast majority of spine issues out there, and that's not only confirmed by our research, but there's a gentleman out of New York, Greg Lutz, who does a ton of spine research, and he's been involved in the spine field for 3 decades now, and his research pans that out as well as many other people out there doing research in this area. So again, we typically don't need stem cells for spine. Well, let me, hopefully you got that website down. Let me just pop this window back up again if you need our information. Again, if there's questions that happen to come up after this webinar, don't hesitate to call us at that number or send us an email. And certainly, if you're interested to see if you might be a candidate for this, or just looking for a second opinion in terms of your own orthopedic issue, give us a call and we can get you scheduled for an evaluation.
Okay, I have yet another written question.
Okay.
This is from Myra. She says she has a lot of arthritis, already have had both hips replaced, right shoulder reverse replacement, severe degeneration in left shoulder, knees are also going. Do you do x-rays at initial consultation? Do you think I'm too far gone?
Well, I mean, obviously there's not much we can do about the hips or the right shoulder. As far as knees go, I mean, oftentimes, my guess is you probably have had some x-rays done already, which is what's showing you, or at least somebody's telling you have degeneration. So, if you can collect those x-rays or at least the reports, that's oftentimes enough at the initial evaluation. Before doing stem cell procedures, though, we usually take that next step of getting an MRI of the joint, in large part just to assess the bony health, because as I mentioned before, sometimes if there's too much, disease process or death to the bone, that would tip off that you may not be a great candidate for this. So we get an MRI just to give us, a better idea to provide you with a more thorough prognosis, what you can expect from this type of treatment. So no, I wouldn't say you're too far gone, but it would help to evaluate what you've had done so far, examine you, get the history, and then if it's deemed viable to move forward, again, the next step would be getting an MRI to take a closer look.
She did ask whether you do x-rays at the initial consultation.
We don't do x-rays. Depending on the joint itself, we might, check you out with ultrasound, but we don't do x-rays here in the clinic, but we can certainly arrange for x-rays to be done outside.
And then Lisa wants to know whether an MRI is needed for spinal platelet treatment, and if so, how recent?
So yes, and an MRI would be necessary. As long as it's within a couple of years, if it's any older than 2 years, then I would say it probably needs to be updated, but if it's within that time frame, then that should suffice. All right, well, not seeing any other hands. Anything else on your board, Dana?
Nope, doesn't look like it.
Okay, all right. Well, I want to thank everybody for their time tonight. Thanks for joining us tonight. Hopefully I was able to paint a little bit more of a thorough picture for you. Again, if you have questions, please contact us. All right, well thanks everybody. Thanks for joining us tonight, and hopefully we'll see you here in the clinic soon. Bye-bye.